everyone. Thank you for joining us. My name is Chibo Tang. I'm managing partner at Gobi Partners based here in Hong Kong. We have been lucky enough to invite Danny Yeung, the CEO and founder of Prenetics, to have a fireside chat with us today.
At Frenetics, our mission is to give everyone the power to be in control of their own health. From genetic testing to COVID-19 testing, and now to rapid diagnostics, we are truly changing the world. And all of this could not be possible without our extraordinary team members who are so passionate and dedicated in their work.
And I think today, we'll have a period of time, and we'll just kind of go through Danny's story, talk a little bit about Prenetics, and its journey through its development and how it's been impacted by COVID, obviously. And I think the question on everyone's minds, what is next in store in terms of COVID and the world after COVID? And so with that, I just want to say one more thing. Obviously, we are filming this in Tatler House. This is Danny in person. And he's quite a big deal here in Hong Kong. We're very excited. Danny, why don't you start off by just kind of introducing a little bit about yourself?
Sure, thanks for having me, Wise. And a little bit about myself, Wise. Name's Danny Yeung. I've pretty much been an entrepreneur my whole life. I started actually working at a very young age, right? I started working at 12. Right?
Wow.
Selling baseball cards.
This was back in the U.S.
This was
right?
back in the U.S. Yeah, back in the U.S.
Right. Are you originally from Hong Kong? Can you tell us a little bit about your background?
No, I'm actually originally from Waijiao, China.
Okay.
In Guangdong.
I see.
I moved to the U.S. at the age of 5.
Waijiao is also part of the Greater Bay Area.
Yeah. And then so me and my family, we immigrated to the U.S. at the age of 5.
I see.
And basically been living in the U.S. ever since then. I moved to Hong Kong in 2010.
Got it. And so what brought you out to Hong Kong?
Opportunity, right? I think life always takes you into a lot of different ways, and certainly when at the right stage of your life-wise, I think there's certain callings, whether that be personal-wise or work-wise, right? So I think in 2010, coincidentally, at that time I was actually doing a hotel furniture business.
Oh, I see.
Importing furniture from mainland China into the US.
Right.
So already had lots of international experience dealing with overseas, etc. right? But I always had a passion for internet and technology at a very early age. And then early 2010 wise, my friend sent me a link about the US in terms of about a company called Groupon.
I see. Yeah.
And I looked into
that was like all the craze back then.
Correct.
In early 2010.
Yeah, because in 2010 they were the first private company to reach out 1 billion USD in revenue. Right. And at that time there were also not so many unicorns like today.
Yeah.
Right? So it was a huge thing in 2010. Right. It was like Groupon, everything.
Yeah. I remember at that time, China also exploded with Groupon copycats. At one point there were like tens of thousands of Groupon copycats, like one in each city in China.
Correct, including myself. I wanted to do it too. And I decided, I was like, wow, this is an amazing business model, merchants, it's win-win-win for everyone involved.
Right.
I really liked the business model, but I knew if I started that business model in the US, I would get killed.
Right.
Because Groupon's already very big.
Yeah.
They just had raised 950 mil USD.
Wow.
So I was thinking, like, wait, that's crazy, right? Again, today everyone's raising that much, and a lot of people raising that much money. At that time, I was thinking, wow, if they raise that much money, at one point they're definitely gonna want to expand internationally. At that stage, they did not expand internationally yet. All right, and I was like, amazing business idea. I was like, I looked around the world, where was I actually going to create this concept? Then actually thinking, originally I was thinking China, right? And then it's like, and Hong Kong and Taiwan, right? So I was like, okay, I want to move to Asia to do a replica or copy of this business model.
So you came to Hong Kong not knowing anyone.
Not knowing anyone,
with nothing here, no friends, whatever.
I had like a few friends, but I certainly did not have like the network like I have today. It took a course of 11 years, right?
Right.
Yeah.
So you came to Hong Kong to start Groupon.
The Groupon concept.
The Groupon concept,
which was called You Buy, I Buy.
Right. And how did that go?
It was crazy. When I came to Hong Kong, everybody actually told me, hey, this business model would not work in Hong Kong. Like, of course, you meet people and say, go back to the US. This model's not going to work. Because the restaurants, the merchants, they're not going to give you that discount. Rent's expensive, and also maybe at that point the most important thing at that point is like no one uses e-commerce. Right, and then so everyone's saying e-commerce doesn't work because it's too convenient in Hong Kong. right? And then so people told me to leave, right? And I was like, you know what, I really believe in this business model, and stuck it out.
Right,
and,
right. Yeah, it's that conviction that really makes every entrepreneur, right?
Yeah.
A success or failure. Yeah. So ultimately, what happened there?
Ultimately, what happened? Moved here March 2nd. On June 28th, we launched our first deal.
Wow.
The first deal, we sold 400 vouchers.
Wow.
And it was crazy because I didn't know what to expect. I didn't know if the website was going to work and people were going to buy. I still remember vividly the first deal was $99 for $400 worth of haircut services at Tony and Guy. And ultimately, we're able to scale really fast. When we launched a business, we only had 4 people. By the 6th month, we were already doing $1 million US in revenue. And we only had 11 people.
Okay. Wow.
Right, so very lean team. Everyone was doing everything. Wiping floors, marketing, sales, merchants, customer service. And then in December, already Groupon actually then acquired 51% of the company. But within 6 months, they acquired a majority stake. And of course, I stayed on as the CEO. Then, of course, it became Groupon, original company called You Buy. Then we ultimately were able to scale that business. My title at that time was Groupon East Asia CEO, overlooking East Asia. And then of course they bought the rest of the shares.
I see. Yeah. No, that's super interesting, and I wish we could delve more into that. But I think for the purposes of today, I mean, let's switch gears a little bit. And so after you left Groupon, you were looking for your next thing, right? Your next venture. How did you come across Frenetics?
Originally, actually, I left on April 28th, 2014, actually the same day my daughter was born. And actually when I left, I actually wanted to slow down a bit because Groupon was quite intense. Every day.
Life of an entrepreneur.
Correct. Very, very intense operationally. And then I did a natural thing for many entrepreneurs after they have exit, start angel investing. Investing in early stage startups.
Yeah, you have some nest egg, you just exited, big exit.
Correct. So I did that realistically for about the next 6 months or so. And I was thinking I wanted to do that longer term. But then via investing, I think I still had a lot of passion to do something again. And I wanted to actually do something in healthcare.
I see.
Right, so I did make some investments, some which turned out to be quite good. But certainly I didn't want to create a new company again. And what fascinated me was a company called 23andMe. They started out in 2010, I believe.
Oh, okay. So they had been around.
They've been around for a while already. But in Asia-wise, it was really early, right? Nobody was talking about genetic testing or DNA testing, right? And then I was thinking, hey, this is really. Every time I find something, it's like, hey, I find myself being very interested and fascinated at the concept. I was fascinated that with saliva, you can understand so much information about yourself. It's like crazy, right? Before I don't need to do a blood sample, blood test or whatever. I can find out so much information. And I was thinking, questioning, hey, how come this isn't available in Asia? Initially, I couldn't find my own team because I couldn't find the scientists to come work for me, right? I didn't have that network or that scientific background as well. And then coincidentally, I met a professor, which is a chair professor at the City University, Professor Michael Yang, and then he had an existing company that was looking for funding.
Oh, I see.
And then I went in.
So you already had the technology.
Yeah, he had the scientific people. About a team of about 7-8 people, but they had zero commercial aspect. I went into the laboratory. And they were looking at funding. They were looking for maybe. I think at the time, it was like 7-8 mil HKD.
About $1 million US.
US. And then that's where I came in. I said, you know what? You already have the scientific team. Your team is really passionate. But this is where I can help. I can say, you know what? I'll give you guys 3 mil US. I take majority of the company and I become the day-to-day CEO. And I said, if I don't succeed in the next 12 months wise, I will leave myself because it's not worth my time to be in a small company. And my most valuable asset is time, And then in a way, it was a deal they couldn't resist. And then within 12 months, I was able to number one, change the name. The original name was called Multi-Gene Diagnostics Limited.
Very long name.
Very long name and
very scientific.
Very scientific. And then I changed it to Frenetics. It's easy.
So what's the story behind Frenetics? It's obviously a play on genetics.
Prevention.
There you go.
Correct. And I was surprised no one took the domain name.
Right. Yeah.
Because it's two names come
Right.
together.
Right. Prevention. I see.
And then that's ultimately why I wanted to start this, because I wanted to empower people with knowledge about health, data, and the more knowledge and data that you have, the more you can do something about it, and that ultimately leads to prevention.
Of course.
Yeah.
So by the time we came around, I mean, like you guys had already had like a year or two of kind of just like figuring things out, looking like bringing the product to market.
Correct, yeah.
We actually invest in Frenetics out of the Alibaba Entrepreneurs Fund that we manage as the GP. And so, we actually co-invested with Prudential.
Yeah.
Who was the lead for that round. Can you tell me a little bit about obviously genetics and kind of genomic sequencing and all this stuff? You guys had kind of made like the core of your business for the first 3 to 4 years of the company. When COVID happened, what was going through your mind?
I was like, shit.
Yeah.
I think everyone was like, shit, right?
Right.
So, I mean,
at that point, early 2020, you guys had already been, investing heavily on the genetic side.
Yeah.
Right. Like you had a JV in China
with
Barry Genomics. Yes. You had already bought out kind of this UK lab, UK company, DNA Fit. So you guys had already, had China, you had like UK, you had Hong Kong, obviously. You made a big push even on the marketing side, right? Like having Gem, right? Some of these other like celebrities in China.
I've taken the Prenetics Circle DNA test, and my results show that I'm negative for 8 common cancers, including breast cancer and pancreatic cancer. I believe that understanding our DNA is the first step to a path of good health.
With so much invested already, what made you really decide that, when COVID comes, shit was the first reaction, but did you think about, maybe I should double down on genetics, or right away you were like, okay, well actually, COVID testing is this new opportunity?
Yeah. So to be honest, it was a lot of uncertainty, I think, for so many businesses globally, right? And then certainly I don't think anyone knew what to do.
Right.
We just needed to wait and then react. I think this was a pandemic that no one could have predicted. And so certainly we just had to have a little wait and see. But even for us as a company, we were very uncertain about what was going to happen, because I remember quite vividly even February or March of last year here in Hong Kong, right? It was really when things started getting serious. And then we actually had to consider at that time, because we were uncertain in terms of doing layoffs.
Right.
And then we actually, at that time, we actually said we did not want to go layoffs. We did not want to do layoffs. What we did then do initially, we actually did a no pay leave.
Oh, really?
For basically everyone in the organization.
Right.
At that time, we had maybe about 120, 30 people.
Right.
And we said we'll do a no pay leave. Ultimately, my role in the organization is making sure that we can sustain as long as possible through the uncertainty. Right. So I said, basically, we'll do no pay leave 1 day of the week for everyone. Right. So including myself. So it's roughly 20-25% reduction in pay. Right. However, I did say that if in the event that somehow we would be able to make our annual revenue target, we would give back this no pay leave. Right. So it's like, hey, it's not just cut. If we do well, then of course, because at that time there was a lot of uncertainty. Right. So that was of this employee aspect.
No, that's a great way to manage, everyone's expectations and just find like a compromise, right?
Correct. But I think at that time you don't know what's going on, right? And I would rather have a safety cushion. We didn't know that we were going to do COVID testing. Right. It was not until April of 2020 where we started thinking about this, and certainly because then originally, and how we started thinking about this was that here in Hong Kong, I'm not sure if you remember last year in Hong Kong, right? Initially, it was very difficult to do COVID testing.
Oh yeah.
You had to go to sanatorium of the
all the public and private hospitals.
And it was
only a few.
Only a few.
Yeah.
And then it was $3,000 to $4,000 HKD.
Yeah, very expensive.
Very expensive. And at that time, everyone was very scared. Nobody wanted to leave their homes. Correct. So you have to pay it very expensive. You have to leave your home.
You have to go into a hospital where all the cases are really concentrated.
That's scary.
Yeah.
So my reaction was like, then I talked to the team, hey, is this something that we can do?
Right.
And then April, we launched Project Screen by Prenetics which was an at-home COVID-19 test kit.
happy to be here with Danny and Nick from Frenetics. I think that this is a very, very good initiative on behalf of the government, the Hong Kong government, because we know the coronavirus, it transports very, very quickly, and one person can infect 4 people. Frenetics has done a very, very good job. I'm very proud of them. Everyone in Hong Kong will eventually be able to be tested, and that's the only way we can get the numbers down.
We actually have about 12 vans all Hong Kong, basically to distributing the kits. So for example, this restaurant we have 4 employees, we'll distribute the kits. Tomorrow our team will also come back and collect the kits. We started this program last Saturday. Again, we had a few days of ramping up period, but thus far we have already passed out approximately 20,000 test kits. Overall wise, it has been growing really well, and great receptiveness and feedback from restaurant, the staff, and also from customers.
Every restaurant in Hong Kong should protect their staff, and then they will protect the customer. It's something that's very, very, very important. So make sure all of your staff do it, and let's help Hong Kong to get the numbers down.
How much were you selling that for?
$785 each KD.
Wow, so that's significantly lower than the 3,000-4,000 at the hospital.
Yeah, correct. So we actually broke through the barrier in terms of people's and made it simple, easy, and accurate. Right? So our test was, certainly approved by the Hong Kong government. We had a meeting with the chief executive of Hong Kong, etc. to get their support if we were to do this. Right.
Now, obviously, that technology and that test you guys had developed in a matter of months, and this kind of leads me back to like a question that I've gotten from other investors when they ask me about Prenetics. It's like the tests that you guys do, whether it's in COVID or whether it's in genetics, like how much of this is like real science? How much of it is like, I guess like pseudoscience, some people have called? Like, how high are these entry barriers, right? Like, is the technology really like unique? And
Yeah, so I think for each of the different products, let's say when we're doing our genetic testing, right? We're using a technology called whole exome sequencing. So that we're processing enormous amounts of data. We have very complicated algorithms, right, to be able to process and present results out in a very easily readable format. Give you an example for 23andMe, they process roughly 700,000 SNPs. Our data set has 31 million data points.
Wow.
So significantly much more accurate, significantly much more powerful. That allows you to have much more reports, right? If you compare that with COVID testing is actually much simpler. Right? However, of course, the consequences are much more deadly in terms of negative and positive, right? So it's been very well validated. But certainly I think the key for any science or technology is how do you create an end-to-end solution? It's not just good enough that the science works. So how do you deal with the infrastructure, the mailing in of the kids, getting to the laboratory, getting it to scale?
So it's basically, I mean, you've taken kind of like an internet entrepreneur's mindset and approach to kind of healthcare and diagnostics, right? Like it's not just the science, it's really like how you bring the science to the market, how you present it to the customer, and just distribution, the branding, and just like the overall kind of product.
The overall experience.
The overall experience. So I guess, I mean, like at this point, right? I mean, obviously you guys have added on this like very successful COVID screening business. And like there was some big news like a few months ago that you guys are helping to screen for the EPL, just in the UK, just like helping to start these things. You guys are live in Heathrow Airport. You guys are also talking to like various airports and governments here in Hong Kong and around the region. What is next?
I mean, it's been a crazy last 12-13 months. I think my team and myself, we've been just working nonstop pretty much. And to share some numbers, now we've actually have already processed 1.5 million PCR COVID tests in the last year. As you mentioned, last May we started working with English Premier League, helping their season resume, and then of course afterwards as well. So we tested 20 clubs on a weekly basis. We work with a lot of large private organizations in the UK.
What we know is a guided swab is completely accessible, safe, done in an open air environment, a good environment to continue the sort of process to get back into work or to the event that you might be going to. In some cases, if an individual is looking to take a flight where a country is specifying a particular type of test, such as a PCR test, we are intending to make sure we have this national footprint rolled out in the UK to facilitate that process with a trusted brand, Frenetics as you know it.
It's fantastic to be one of the first businesses to have one of these green testing pods, knowing that actually I could be tested, that my team and our customers can be tested, and those in the local area. We're just wanting to do anything we can to help get Britain back to work.
So our goal is to help develop a network across the country so that whoever you are, we can facilitate very quickly a place you can go to get a test taken to get back into work or to the event that you might be going to.
Here in Hong Kong, we work very closely with the Hong Kong government. As you know, we would do all the testing for all the Hong Kong community testing centers on Hong Kong Island. It comes back to our laboratory. We have a daily capacity-wise of roughly 20,000 daily tests.
Right. And you guys are expanding that, right?
Yeah, because we're expanding the
making
laboratory,
making
more laboratory space. And certainly, we're getting a new office in K11 across the street. So K11, New World's our new investor as well.
Of course,
So what's next? I think with COVID-wise, right, the acceptance of people's ability to do testing, and that makes it easy. And certainly, I think health is now one of the top priorities, right? Because the best way to protect against COVID or other diseases coming up in the future wise is make sure you have the best immunity of health, right? And then so I think with that wise, I think there's going to be two key areas that's going to be really, really impactful from both a individual level and certainly from commercial perspective, right? So I think certainly we do a lot of laboratory testing, but even last year we started thinking, hey, the laboratory testing is not efficient, it's not scalable, right? And it's also not convenient. So we thought long, how can we potentially solve this, right? And so this is where last year it started. That last October, we actually made an acquisition of a University of Oxford company, a spin-out company called Oxy, and then they had developed the technology for a rapid COVID-19 test. And then so we got in touch with them. They're scientists by nature. They wanted to work with a company that can help them with both future development of the science and at the same time commercialization.
So almost exactly the same as how Prenetics was started, right? I mean,
yes, in a way. Very similar,
very
right?
similar,
So always, if it works, it works. I will use it again.
Of course.
So we acquired that company, and they had the technology to make rapid point of care testing for COVID-19, which was then kind of like in like computer shape, format.
Is this technology unique? I mean, can other people do this?
There's probably maybe about 5-6 global companies globally that have similar technology. It's similar to how there's a lot of technology for different PCR testing or electric vehicles, right? So I would put it in that category. So I would say we're the best too.
Of course,
and we've taken that technology, and what we want to do with it is actually enable people to do at-home decentralized laboratory testing in the comfort of your own home.
I see.
So for example wise, the next time, let's say in a few months time wise, if your friends and family, let's say it's big gathering wise, right? You want to do COVID-19 testing, you imagine you can do it at home. And then so actually I have a prototype here.
Oh, this is great.
So this is a 3D printed prototype. But so the idea is that in the future,
it's quite small. It's like
very small.
Yeah, it's like half a hand.
Half a hand. And in future-wise, this will be a single-use cartridge, and then this will be a reusable reader, right? And then so this will be actually, you go to Watson's, Mayonnaise,
razor blade model, right?
Razor blade, correct. Exactly, right? So this is actually
the device will just keep
has sensors, PCB boards, a heater as well, and then this will be a single-use cartridge. Then once you do your swab, you put it in here, then you put it in here, and then basically turn it off in 20 minutes. You'll get your results in your smartphone.
Wow. In your smartphone?
In your smartphone. So everything's going to be digital, of course. It has to be this way. Then you can then share that with whoever you need to show that to. Hey, I'm clear, clean. And show the date.
So you can imagine having to do this. You walk into a hotel, an airport, even as at home hosting guests.
Correct. Because then there's too much downside of not testing.
Of course.
If it's simple and easy, then the question becomes, why wouldn't you test, right? And we want to make it affordable.
In the future, could you once COVID is no longer one of the burning issues, what other tests or what other things could you use this for?
So a lot, right? I mean, just to share, we're spending roughly right now we earmarked roughly 30 to 40 million USD for product development on this device.
Wow.
And of course, it's not just for COVID, right?
Yeah.
It's actually for all infectious diseases. So certainly we'll start with COVID, and later on you would be able to do influenza, flu, HIV, and certain other types of STDs.
I see. Wow.
So incredibly impactful.
So all of these tests, I mean, like have been, you had to go to the hospital. You feel awkward going to, like
nobody wants to go to STD.
Exactly.
Right.
But I know at-home diagnostics is really the future.
Yeah, at-home diagnostics is definitely would be the future, because it makes sense. We can do so much at home nowadays, but if you think about healthcare, it hasn't really changed. You still have to go to the doctor, you have to go to the lab, right? But the technology exists today. That we can bring it into the home.
Make it super accessible.
Super accessible. And imagine then people, they're positive wise, hey, 20 minutes and one day, if you're positive, then you're not going to go out, you're going to limit yourself, right? And certainly I don't think people are bad people. Correct? And then so I think this has a game changer type of product that can really change how we live and care for each other, and then also bring a big sense of normality back to our lives.
Of course, that's what all of us are looking for.
Yes, correct.
On that note, I think everyone is kind of wondering, in a post-COVID world, or like after 2020, where are we, like how are we going to get to that normal, right? Like, and I know that you're such an expert in this space, you're at the forefront obviously of all the testing. Like, where do you see this going? How do you see like COVID playing out over the next 12 to 24 months? I mean, like, are the vaccines really going to just negate the need for tests? I mean, how are they going to be rolled out? Like, what's the impact?
So certainly, of course, I get asked this question quite often, right? So vaccines is great, right? So if you look at it data-wise, it works, and it's been able to both reduce the severity and also reduce infection. So certainly that's going to help a lot in terms of speeding up the normality. But certainly the challenge is not everyone's going to get that vaccine.
Of course,
right? And certainly if the testing is made easy, simple, and available, then certainly people will still do the testing. So we believe that testing will still be a very normal thing, for at least a minimum next 3 to 5 years.
Okay.
Because it's going to be a while, right? Because again, if that testing is simple, then it becomes like normal. So imagine right now this takes 20 minutes. Imagine if that takes 5 minutes, right? Then what's the downside risk to doing testing if that cost of that testing is, let's say, $50 HKD, right? So we feel that even with vaccine rollout, I think the sense of peace of mind, and certainly that will be very, very important. So I think testing is going to be the new norm. Certainly people will have to produce vaccine reports wise, and check if they have antibodies, and also do testing. Right? So these all three will be part of returning back to normality and part of travel.
Wow. So you don't see this like playing out until another 3 to 5 years?
I mean, I think testing and the great thing about what happened is that people's health, people's how they look at health and the importance of that has certainly been to the top of mind, right? So I think that's one of the benefits. But certainly I think longer term wise, I think testing is going to be the norm.
I think just one last question, just because for Gobi, I mean, obviously we have we've been building out our presence here in Hong Kong, and not only just in Hong Kong but also in the Greater Bay Area. Obviously, the Greater Bay Area has 9 mainland cities and 2, special administrative regions in Hong Kong and Macau. Like me sitting in Hong Kong, actually, I've been waiting for the day when I can actually go into the mainland without quarantining, right? Because obviously, I mean, now Shenzhen has 14, 24, 21 days of quarantine. And so, like, do you have any information around that? I mean, like, when are we going to be able to go travel freely within the GBA from a Hong Kong perspective?
I think certainly vaccines will have to play a big role in that in terms of the rollout wise, right? So I think that's going to be the first part, but certainly I think from all indications, I think everyone's looking forward to maybe Q2, Q3 time frame wise, right?
Okay. Well, I hope that's the case because that's within 6 months. So.
Yes, correct. Because I think so many of us, there's so much that we need to do, whether it's for business, seeing friends and family, right?
Okay. Well, thank you so much for your time, Danny. Obviously, I mean, it's been super exciting and informative just to hear about your journey as an entrepreneur. Obviously how Frenetics has developed and evolved as a company. And I think, that's some good news on the COVID situation.
Thanks, Chibo. Thank you, guys.